Great to have you on the programme. Thank you very much for being here. So just talk me through the announcement today. What are you trying to do?
So, as I think people will know, in the budget, the NHS settlement was larger share of the budget than other departments in a very difficult budget, and we said all along that that would come with reform. So today was about setting out the stages of what that reform might look like. It'll be followed up by some technical documents called the NHS mandate and oversight frameworks and things like that. But we've been very clear. We were very clear in our manifesto, we're very clear with the British public that the NHS, we want it to survive and thrive into the 21st century, but it has to change. And today was about setting out some of those steps.
The kind of headline announcement is league tables for hospitals, right? So kind of publicly available league tables, and if trusts are not measuring up, then the people involved could be sacked. I just feel sometimes like, your kind of rhetoric around the NHS is up here. You say it's not on its knees, it's on its face, it's broken. No reform, no change, no more money without reform. And yet at the same time, what your big shiny reform is to introduce a league table system that was already tried in 2005. I mean, is this big enough? Is this ambitious enough?
Well, it's got a package of reforms. I know headlines are sometimes
so
grab the attention.
What's the big reform? What's the big idea?
One of the things I'm really pleased to see as a former NHS manager myself is about leadership being properly developed and supported, both clinical leadership and non-clinical leadership, so that we give those local leaders the right support, the right skills to do a very, very difficult job. We know that some marvellous things happen in different parts of the NHS, some really high-skilled care, some really efficient care, but we know that that is not spread throughout the system, and that's why we say we want to take the best of the NHS to the rest of the NHS, but leaders need support to do that. So one of the things we're talking about today is that leadership college to give people that support. So that is about encouraging, it's about a better culture, it's about rewarding people to do what is a really difficult job. And the league tables idea is not about just punishing people. If people aren't doing the right job for their local populations, then it's right that they're no longer there. I think most people would agree with that. But it is about transparency. It is about accountability. When we've been out in the election campaign, people want to support the NHS, but they're quite sceptical about whether it can survive.
Yeah.
They're quite sceptical about the extra money, actually. And I think it's really important that we're able to demonstrate value for taxpayers' money and accountability for good services.
But I guess this is kind of my point. You're talking there about, the survival of the NHS. And you're right, a lot of people are worried about that from all sorts of political persuasions. You're talking there about the need to reform. You can't just keep throwing money in. But the reforms seem, with all respect, not that massive. If you talk about league tables that have been tried before, but you're talking about, more support for development and leadership in different parts of the NHS. I mean, this doesn't seem like the root and branch reform of the NHS that we were promised.
So the large-scale reform is the 10-year plan. So there are a number of things going on, and I don't expect everybody to be able to keep up with every detail of that. So when we set out the 10-year plan and when we set out the consultation exercise, which we did recently, and that's still available, if people want to give in their views, we really welcome them, staff, the public, patients, at change.nhs.uk. We're getting some fantastic responses on that. That all feeds into the 10-year plan, but we're not waiting for the 10-year plan in the spring. We have to make sure that the money that's going in this year and next year is immediately transformed into good outcomes for patients.
Yeah, I don't understand what the big idea is. You're right, you have got this big funding, record levels of taxation. Yeah. What's the big idea?
So the big idea
isn't a 10-year plan.
The big idea is to shift care from hospital to community, into neighbourhood centres particularly, to move from an analogue service to the digital, because we're not using the best technology that we can, and from a sickness service to prevention. Those are what we call the 3 shifts. Those are the big ideas that we want to make happen. We know that's going to take up to 10 years to do. That's why it's a 10-year plan. And what's set out today is some of the tools, some of the indications and the messages to those people in the NHS about how we see reform working. We want to work with them to deliver this. So it's a package over a period of time.
I was keen to talk to you as well about the rise in employers' national insurance contributions, because there's been a lot of concern about how this might hit everything from GPs to pharmacies, but also hospices as well. And, for many people, anyone who has seen a loved one die of a terminal illness like cancer, or people struggling with long-term terrible health conditions, will know the importance of hospices. You know, sometimes that is like the kind of glimmer of humanity in your darkest time. Surely you're going to do something to help hospices who say they're going to be hit by this, and some might even have to close.
Well, of course, you're absolutely right. They are a lifeline for so many people, and it's important that they are supported. And as the Health Secretary has said, that we are obviously looking at that. He hopes to be able to announce any further measures on that before Christmas. We know the budget's hard.
Can you just promise hospices
I
that they're going to be okay?
can't promise that now. I can't promise exactly what that will look like now. We know they're an important part of the landscape of care for people. We know that's true of GPs and primary care. We know this budget's really difficult. The population knows that. The Chancellor's had to make some really difficult choices to get the economy back on track and to make sure that we do have public services that do survive.
We're talking about end-of-life care.
We are.
Here, right?
It's really...
Why would you announce something in a budget and then say afterwards, after everyone's really, really worried about what it means, oh, OK, we're going to try and look at it? I mean, surely you'd have thought about this before. Well,
we have to look at things in the round. There are a lot of different impacts in different parts of the economy, public sector and the private sector from any measure that Chancellor takes. We all know that this is all very difficult and that the Chancellor's had to take some really difficult decisions. I think the population know that as well. And we do need to look at the implications across a whole range of services of that budget, and that's what we will continue to do.
I want to talk to you a little bit about assisted dying. Wes Streeting has said he'll vote against, has some practical concerns about the fact it could cost the NHS money, and he's also, we understand, announced a review into the cost of assisted dying. Do you share the Health Secretary's concerns? Well,
just to be clear, there isn't a review into the cost. That's not what Wes Streeting said. It's absolutely normal for any legislation that's going through to be looked at by the department, whether the Ministry of Justice, Health Department, to make sure that the department is ready to do whatever Parliament decides. Wes Streeting and I are on different sides of this discussion at the moment, as many parliamentarians are. I'm a long-time supporter of choice at the end of life. I think it's fundamentally important for people. So parliamentarians have got very different views. The crucial thing is that Parliament will decide. It's a very finely balanced judgment for many people. People are still deciding. It is a difficult issue. We all understand that. And I think Kim Ledbetter is doing an excellent job in being respectful of people about that. But whatever Parliament decides, the government will abide by. That is how our democracy works. And I think we will see a good discussion, particularly if it gets through the second reading and really scrutiny line by line in committee, which is how our parliamentary process works, and get a chance to really get into the issues. But the government will do whatever Parliament decides.
The question was whether you share the Health Secretary's concerns about the cost of assisted dying to the NHS.
I don't agree with the Health Secretary on the issue of this vote on assisted dying. We're on different sides of the argument.
About the cost specifically, do you think that... Do you I'm just trying to work out your view on the cost of it, because he's made his view quite clear. So you obviously believe in assisted dying. Many people would agree with you on that. But do you have concerns over the cost of it?
No, I have concerns about people's choice at the end of life, and that they are treated in a safe and humane way, and that they have choice over the end of their life in the same way they expect the rest of their life. And the government have made clear, and government ministers make clear, that government will do whatever Parliament decides. That's how our democracy works, and that's absolutely right and proper.